So good day, everyone, and welcome to the second session of UP Manila SILab IOL 101 Webinar Series 2025 to present us the Open Health Information Exchange adoption in the Philippines. Let us virtually welcome Dr. Alvin Marcelo.
Good morning, Gabby. Good morning, everyone. I'm pleased to present to you architectural discussion about what might be the future of interoperability in the country. And this is something that's close to my heart. Open Health Information Exchange is a community that has been very supportive of the Philippines and of AHID and of Asian countries. Let's talk about the people. So essentially, OpenHIE is about an open community of practice with participation from anyone who desires to contribute, interested in solving the problem of health data interoperability. So let's just differentiate what are the differences and similarities of integration and interoperability. The fundamental commonality between them is that there's exchange of data, but then the semantic understanding of the data that is being exchanged from one system to the other is really the difference. So let's talk about architecture in digital health. So OpenHIE is one such architecture designed to be a centralized model where data can be captured at the point of service. These are the systems at the bottom, colored black. If we build an interoperability layer, the one in green, and we create the right component layers at the top of the interoperability layer, then we are more able to build good interoperable business domain services at the top. So essentially, OpenHIE is saying, yes, you can build point-to-point systems, but you can also opt to build an OpenHIE type of systems, in which case you now have the potential to have interoperability between these point of service systems at the bottom. So OpenHIE is a digital public good, and a lot of other software are already using it. The point of service applications, we have a lot right now in the Philippines. What they do is they collect data and they make the data relevant to the end user. However, the limitations of the point of service applications are felt when the patients need to traverse the health system and transfer to another facility. A critical component of the OpenHIE architecture is the interoperability layer. It's basically the workhorse of interoperability. As you can see, it's in the middle of everything. When it receives the message from a source entity, it makes sure that the payload or the data inside that message is compliant with the component registry services, and then it sends the message to the appropriate destination entity, whether it's a laboratory, a pharmacy, or another clinic, or the hospital. The third layer of the OpenHIE architecture is the registry services. So these are the components that sort of provide the standards to the words or the terms inside the message that you want to exchange to another facility. For example, we need to make sure that the identity of the patient is consistent as the messages are being transferred from one facility to another. Now, when we have those three layers available and communicating with each other according to the rules set by the OpenHIE architecture, then we can start populating the business domain services. We can start having logistics management information tracking and services. We can have a shared health record so that when a patient transfers from one facility to the other, the second facility will have access to relevant data from the first facility. We can have a health management information service for epidemiology and surveillance, and we'll have more effective and timely finance and insurance services so that patients don't have to worry about, do I have enough money to pay for my confinement? So the Philippines is one of the first adopters actually of OpenHIE. On the left, you see the OpenHIE architecture. On the right is what we call the Philippine Health Information Exchange, which was published in 2014. I'd like to start with the adoption of DOH of the AHID Mind the Gaps framework. So now let's map agency to the OpenHIE architecture. DOH has already committed that they will take care of the logistics management information services, shared health record, and health management information service. And PhilHealth will take care of the finance and insurance service. At the component layer, registry services, DOH said that we'll take care of all of these registries are optimal and are available to the point of care services and the interoperability layer. The interoperability layer will be supported by the DICT, and at the bottom, point of care services will be supported by the healthcare provider networks. All these things in blue are already activated. So they are now work in progress, and we are closely monitoring these systems. Make sure that they will reach a level of maturity so that we can have all of these components supporting the OpenHIE architecture. UP Manila is supporting the terminology services. We hope that at some point we will be able to offer terminology services to the country. PSA has already activated the PhilSys system. There's an API already with support from the ICT. The Department of Health already has a facility registry. It's accessible at nhfr.duh.gov.ph, and FDA already has a product catalog that we hope can become also exposed to the OpenHIE architecture through application programming interfaces or API. And so there was a partners meeting last October 14th, and we had additional commitments from our partners. Some of them are in the call. World Bank committed to support the client registry. CSIRO from Australia supports UP Manila SILab for terminology services. And other partners at the right lower corner for point of care services, QUICA, USAID, World Bank, ADB, DOST are all on the ground already helping areas, HCPNs, healthcare provider network. So I hope that at some point we will be able to summarize all of these through a RACI matrix. Who is responsible, who's accountable, who's consulted, who's informed when it comes to the point of care services in this healthcare provider network, who's RACI for the National Health Facility Registry, the RACI for terminology services, so forth and so on. And that will become now the basis for some policy documents and circulars that will come out soon in support of the OpenHIE architecture, of course, with the National Health Data Repository. So I think that's my last slide. I think just wanted to emphasize that this project we have right now with CSIRO called Strengthening Standards Capability Project, or SSCP, is very strategic. When we go live with our terminology services, with our training on FHIR, on ontology, on SNOMED, we hope that all of the stakeholders would be able to level up so that now we're using the same terms, using the same codes. Even if we use different electronic medical records, different databases, that's fine. You want to make and create your own systems according to your own business processes. But when it comes to terminology and code systems, we hope that you can avail of the terminology services that SILab will be offering soon.